Basically, kidney stones most commonly occur in the age group between 20 to 50 years of age. It is more common in males as compared to females. So, kidney stones, they are not so much common in children, but if it occurs in children less than 10 years of age, then there must be some anatomical or functional problem in the urinary tract, and it has to be evaluated properly. So the causes of kidney stones, it is more kidney stones are more common in those areas where the persons there is hot and humid climate. So the persons who work in hot and humid climate, so they get dehydrated very fast. So in these patients, in those persons, the kidney stones are very common. Then the patients who are taking a diet which is rich in oxalate, like who are taking a lot of spinach, cashew nuts, they are eating a lot of chocolates, then black coffee. So this is also the common cause of kidney stone formation. Third is your the persons who are obese. So obesity is also important. Then persons who are diabetic, the persons who are taking a lot of supplements, particularly vitamin C supplements, and particularly post bariatric surgery, the persons who have undergone bariatric surgery. So post bariatric surgery, there is absorption of oxalate. So in these persons also, kidney stones are very common. And the last is role of genetics. The persons who are having a family history of kidney stones, so those they also develop kidney stones, very common. So the patient who come to our hospital, the most common is the pain in the flank area, in the back area, and that pain is radiating to the front of the abdomen and then going into the thigh. So that is the most common symptom. Then second is blood in urine. Some patients they present with the urinary tract infections and burning sensations. So these are the common symptoms. And on rare occasions, if the stones they completely block the kidney, then patient can present with uh, decreased urine output or complete absence of the urine, which we call it as anuria. Or some patients presents with the renal failure. So the most common symptom or the warning sign is the pain which is not relieved by taking oral medications. Second is there is a blood in urine if the person is having a UTI and fever, and the symptoms of kidney failure like swelling in the body, decreased urine output. So these are the warning symptoms. So you should consult a doctor and visit the hospital, particularly urologist. Most common because most of the patients they get their ultrasound. So commonest procedure is the ultrasound and the urine routine. In the urine routine, we see the number of RBCs or pus cells in the urine, or crystals in the urine, oxalate crystals or uric acid crystals. But the test which shows the 100% accuracy is the CT scan of the KUB area, kidneys, ureter, and the bladder. So if you ask me the single test by which we can confirm whether the stone is present or not, that is the CT scan. But the commonest test done is the ultrasound. Depending upon, so basically we treat the patients accordingly the about the whether he or she is how much symptomatic. So how we, if the patient is symptomatic, is in pain, and the stone size is more than 6 mm. So mostly the patients who are having a stone of more than 6 mm in size in the ureter, which we call it as the kidney pipe. So mostly we have to remove it by the surgical intervention. The stones which are less than 6 mm in size, we start with the medical management. We have a tamsulosin, which helps in the expulsion of urine. Then there are liquids like sodium potassium citrate, which helps in the dissolution of stones. And so first is depending upon the size. Second thing is whether the stone is causing any damage to the kidney or not. If the stone is small in size but is causing severe pain or is causing severe hydronephrosis, means swelling in the kidney, and it is causing damage and it is stuck for the last 3 to 4 weeks, then we go for surgical intervention. And in the surgical intervention, mostly it is endoscopic only. So it is endoscopic surgery. There is no cut in the body. So and the recovery is very fast. We have advanced laser nowadays, even in the stones in the kidney, around 10 mm, 15 mm. So we remove it with the help of lasers. We call this surgery as the retrograde intrarenal surgery. The recovery is very fast. So nowadays, these endoscopic procedures, they are very common for the management of stroke. The most important thing is the dietary management and lifestyle changes. So the lifestyle changes, you have to control the sugar, then blood pressure, then the weight management is very important. The patient who are obese, they have a high incidence of kidney stones. The patients who are diabetic, they have a high incidence of kidney stones. Then if you are having a problem of increased uric acid like gout, so they have also increased incidence of kidney stone. So lifestyle modifications is very important. Then second thing is your diet. In the diet, most important is the intake of water. So you have to take at least 12 glasses of water every day. So around 2 to 3 liters of fluid every day. So that is the most important thing, how you can prevent the kidney stones. Then second important thing in diet is decreased your salt intake, because increased salt intake, it will increase your calcium excretion in the urine. And the most common the stones type of stones are calcium oxalate or calcium phosphate only. Third important thing is decreased your protein intake, because high protein intake, like those patients or those persons who take a lot of fish or meat every day or in the every meal, and particularly you are going to the gym and they are taking supplements, so they have a high incidence of kidney stones. So decrease your protein intake, because high protein intake, it increases your calcium excretion, your uric acid excretion, your oxalate excretion in the urine, and all these minerals, they contribute to the formation of kidney stones. And so three important things: water, then your protein diet, then the salt intake, sodium intake, and the last is take adequate amount of calcium. So there is a false notion that if you have a kidney stones, you stop taking the milk. No. So you have to take around 1 to 1.2 gram of calcium per day. Like you can take 1 or 2 glasses of milk per day. You have at least one bowl of curd. So don't take milk or calcium containing products, milk products, too much dairy product, or not too less. So you have to make a balance. And then avoid the foods which are high in oxalate content, like avoid dark chocolates, avoid taking too much of black coffee. Then spinach contain lot of oxalates. Then sweet potatoes, cashew nuts. So these are the main dietary modifications by which we can prevent the kidney stone.